Hello everyone. In this video, we are going to be reading about pleomorphic adenoma from Pranab Dey. This is the second edition of Pranab Dey. Pleomorphic adenoma is also known as mixed tumor of the salivary gland, just because it is composed of both epithelial and mesenchymal material. The possible origin of the tumor is from the pluripotent reserve cells of the intercalated duct. So PA is one of the most common tumors of the salivary gland, and it comprises about 60% of the tumors of salivary gland. Majority of PA develops in parotid gland, 80% cases, followed by submandibular gland, 10%, paranasal sinuses, oral cavity, upper respiratory tract, and skin. The tumor commonly appears in fourth decade of the life, and there is mild female predominance than male. It is a slowly growing, well-defined, smooth to bosselated, painless swelling. So it would be painless swelling, well-defined swelling, and it will be slow growing. The tumor may frequently recur also and may form a fixed mass with adjacent structures. A large number of PA, almost 90%, arises from the superficial lobe of the parotid gland. This should be kept in mind and therefore easily reachable by FNAC. At times, the tumor develops in the tail of the parotid gland and may simulate an enlarged lymph node also. So, talking about the histology of the pleomorphic adenoma, it is a biphasic tumor. This you should remember, and it is composed of benign epithelial cells and stromal cells. The epithelial component of pleomorphic adenoma is composed of ductal cells and myoepithelial cells. The epithelial cells may be cuboidal, squamoid, plasmacytoid, clear, or spindly or flattened in appearance. These cells are arranged in tubules, acini, nests, sheaths, and trabeculae. Various types of metaplastic changes, such as squamous metaplasia, this you should remember, and sebaceous metaplasia and oncocytic metaplasia is common in epithelial cells. The myoepithelial cells are oval to spindle shaped and may arranged in palisade-like pattern. The mesenchymal components are usually cartilaginous, hyalinized, or myxoid in appearance. Hyaline-like extracellular material may be seen in between the cells and within the stroma. At times, PA is predominantly composed of epithelial element only, and it is known as cellular PA. This is also asked. Occasional large atypical cells may also be seen, and there is no prognostic significance of these types of pleomorphic adenoma. So if we look at the histological image, in the first section we can see histopathological section. It is showing epithelial cells and chondromyxoid material. And in the second image we can see chondromyxoid material. Okay. Now talking about the cytology of the pleomorphic adenoma, the FNAC will yield drops of thick mucoid to myxoid material, and due to its high viscosity, the material is often difficult to spread. So that way we can also know that it is a pleomorphic adenoma. The cardinal three components of FNAC smears are: first one is ductal epithelial cells, second one is myoepithelial cells, and third one is chondromyxoid matrix material. These three components are variably admixed with each other. The relative abundance of these components, it will it will possess different diagnostic problems. So the ductal epithelial cells are arranged in cohesive clusters, gland, trabeculae, honeycomb-like flat sheets, and also singly. The individual cells are usually cuboidal, having round to oval shaped bland nuclei and moderate to scant cytoplasm. The myoepithelial cells of PA are present singly, and they may be embedded in chondromyxoid stroma. The cells may be oval, spindle, or stellate shaped. Discrete oval cell with eccentric bland nuclei gives a plasmacytoid look and may be mistaken as plasma cells by inexperienced cytologists. The third component is chondromyxoid stroma. So the FNAC smear show characteristic abundant fibrillary chondromyxoid stromal material with irregular margins. Spindle cells are often embedded in the matrix. The matrix material is deep magenta color on MGG stain. The chondromyxoid stroma is not well recognizable in pap stain and takes pale gray color. The fibrillar appearance of stromal material is recognizable in pap, particularly at the edge of the tissue. Occasionally, the tumor cells may arrange around the pinkish globules and may look like adenoid cystic carcinoma. Some cases of PA may show predominantly matrix material with scanty cells, but these cases rarely show any diagnostic difficulty. On contrary, some cases may show scant matrix material and abundant epithelial or myoepithelial cells. Unfortunately, these cases may create significant diagnostic difficulties. PA frequently recurs after surgery, and the recurrence of the tumor does not indicate malignant transformation. So, as we can see in these cytology images, the first one shows clusters and associated epithelial cells embedded in this fibrillar magenta colored material. In next image, we can see individual cells are showing moderate to abundant amount of cytoplasm and central to eccentric nuclei, giving plasmacytoid-like appearance. In this image, we can see bunch and long strands of spindle cells embedded in connective tissue stroma. In the next image, we can see it is a cellular pleomorphic adenoma showing discrete clusters of epithelial cells. In the next image, we can see pleomorphic adenoma. Squamous metaplasia can be seen, squamous cells can be seen, squamous metaplasia can be seen. So, what are the differential diagnoses of the pleomorphic adenoma? If abundant ductal cells or poor stroma is present, then the DDs can be carcinoma, monomorphic adenoma, and if occasional hyaline globules are present, then the DDs can be adenoid cystic carcinoma, PLGA, and we should note the myoepithelial cell morphology in these cases. If the cells are plasmacytoid, then the DDs can be plasmacytoma and NHL. If atypical cells are present, we can the DDs could be carcinoma at PA. So there will be the things to be noted down are the absent necrosis, nuclear chromatin, and presence of nucleoli. If the matrix material interpreted as mucus, so DDs can be mucoepidermoid carcinoma. In that case, we should note the matrix and presence of myoepithelial cells.